Welcome back to Body Beautiful. Right now we are talking with Dr. Elizabeth Lee about procedures to freshen up your look for the holidays. We'll be taking your calls with any questions you have for Dr. Lee. The phone number 800-440-4884. We'll also be posting the number for the doctor during and at the end of the segment. And remember, any advice we give you today, you'll certainly want to consult your own physician as well. Doctor, you brought some before and after pictures. And you're so excited. Okay,
I did.
Let's go ahead and roll those pictures and show folks what we're talking about. What's happened here?
Okay, well, what I'm trying to show here is this very subtle but really present changes that we can make in a woman who is in her 60s and who came in complaining really of the folds between her nose and her mouth called the nasolabial folds, but also about the tired appearance of her eyes. And she didn't want her whole face shown, so we're really focusing on the eyes. But what you see in the above is the before picture, and after the picture below is about 2 weeks after the injections. And what we've done is put filler into her cheeks around the eyes, which has, and there's some other views of this if you want to, if we move along of the sideways views. What I hope you can see is that there's been a very subtle but really apparent rejuvenation of the area around the eyes. If you look at the dark circles under her eyes and the kind of loss of the loss of fat right below the eyes where the cheeks sort of look like they're hanging, we get improvement with that.
So you created a little cheekbone there.
We created some.
What? How'd you do that?
Well, we used filler. In her, we used calcium hydroxyapatite filler, and this result will last her about 9 months to a year.
Okay. How about those eyebrows? Her eyebrows look like they're a little lifted. Is she just raising them herself, or did you put something in?
We've done a little botulinum toxin in there too, so we can get a little bit of lift. But also, it's just her being so excited at the way she looks.
Right. She's ready for a party. And this next picture.
And then this is a picture of what we can do with a patient who's significantly younger, but also has a lot of signs of facial aging. She's also, by the way, been on the Obagi skincare, so her skin is quite red, but is in better shape than it was in the picture on the left, which is the before. But the area that we focus on is kind of this flattening of the cheek that occurs, where you can sort of see these red lines that run from her nose, sort of down, on an angle down her cheek.
Is that rosacea?
Well, yeah, that's a little bit of rosacea on her, which we're also treating with laser, so that even looks better now. But there's also a loss of soft tissue volume, and what you see is that the area around her eyes looks much less tired in the picture on the right. And if we go to the next view, you'll see her pre-procedure pictures are above and the post-procedure pictures are below. And again, I apologize for the change in facial expression, but pretty much in the left view, the facial expression is about the same. And there's just a very subtle change that to her eye, to my eye, to the people who work with her, makes her look
but not
much
so obvious
fresher.
That, hey, what have you been up to?
Right, that people will come in and say, did you change your hair color? What's going on? You look great.
All right, so the jowls seem to have a little lift in the eyes. You know what? We've got Martha from Dublin. She's been waiting long enough.
Sure.
Let's go ahead and put you on the air. Good morning, Martha.
Good morning.
Do you have a question for Dr. Lee?
Hi. My question is, I've been dealing with some handles I have in my back. They're big, and I've lost weight, and I exercise a lot, but it just seems like they don't go down. They're just there. My question is, what's better to get done, plastic surgery or a smart lipo?
Well, liposuction is a surgical procedure, whether it's smart lipo or any of the other kind of name brand lipo machines. And so you sound like you're a perfect candidate for some shaping by a liposuction type procedure. I wouldn't get too tied up in what kind of machine you think you would like. I would go to a board certified plastic surgeon who could offer you a more aggressive surgical approach if that were appropriate, but who also has a lot of experience doing liposuction, and then speak with that physician about which machine they use and why.
Okay, Martha, hopefully that answered your question. We've got to take a quick break, but for more information about Dr. Elizabeth Lee, you can call her at 510-704-2170 or check her out on the web at artfulsurgery.com. She's also having some specials this month. It's a mouthful. Here's the Santa's bag. $75 off each full cc syringe of filler when treated before December 12th. Latisse, that's the eyelash grower, is a buy two, get one free. There are limited quantities, so you have to act fast. There's a $50 mail-in rebate for Botox until the end of December, and then a $75 mail-in rebate for Dysport. That's the competitor to Botox, and that's until the end of December. And when we come back on Body Beautiful, we'll continue talking with Dr. Lee, and we'll be taking your phone calls.